Oh, was that a question? I thought you were volunteering to answer for the rock. Ask the question. The question was putting iodine in a water pick a good idea? And I would send you off to watch my little video called Recipe for Oral Health, in which we put iodine in a water pick along with a concentrated salt solution. And it fries those little bugs. Yeah. It's part of one of my half-hour programs that plays on public access TV that is called Bad Bugs. And it talks about how to get rid of bad bugs. So, in all honesty, this information is not new. It should not be startling or shocking or even upsetting to anybody in this room because it's been around for 50 to 100 years. But for reasons that are not clear to me, our profession, dentistry, has extreme problems in moving forward. We resisted washing our hands. Nobody washed their hands even on a regular basis until the AIDS scared the bejesus out of them, so then they got rubber gloves. But now they don't even wash their hands. The rubber gloves, the protocol is to wash your hands before you put your rubber gloves on and take them off and wash your hands again. People aren't even doing that. So, you see the grocery clerks that are wearing rubber gloves taking your food and passing it over. And there's a cognitive disconnect between what the rubber gloves are for and what they're supposed to do. And I remember the old dentist that the staff was just totally shocked because he was really upset because he got his rubber glove caught in his zipper. Did not quite have the concept. So, anyway, in dentistry, we have had luminaries that have brought to our profession profound ideas that should have made us leap forward exponentially. And one of the first ones was W.D. Miller. And he worked in the field of infectious diseases, and he's the guy that theorized that tooth decay and gum disease were infections. And so then Charles C. Bass was the fellow that identified the organisms that cause gum disease, and that Paul Keyes was identified the organisms that cause tooth decay. And then Bob Barkley was a humorist and a preventive dentist, and he made so much fun of the dental profession for not moving forward that they began to talk in dental schools in the 1960s about what Dr. Miller and Dr. Bass and Dr. Keyes had taught us. But because of politics, they didn't tell you the truth. They told you sort of a homogenation of something they'd learned before and taught you before, and something that they could say today, and that way they didn't look too bad, because their ego gets in the way. And that a scientist does not have an ego, because an ego will cause you to come up with incorrect answers. You have to take yourself and set it aside. What if tooth decay is caused by a bug? Figure out what that bug is, what makes it die, and how to do that and measure it. That's just as simple as you could ever want. And that's what W.D. Miller suggested in the 1800s. So I don't know how to make dentistry move forward faster, but I know that you are the people that are going to have to do it, because I've done everything I can. I've talked in 27 nations throughout the world. I've got YouTube videos, several of them with over 1 million views. So the public gets it. I get calls all the time. Where can I find a dentist that will follow these kind of procedures? And I send them off to the IAOMT website. But the public gets it. They get it in a blink. You don't have to hammer it into their head and say, oh, well, the kind of mercury I'm using is the safe kind, or the kind of fluoride I'm using is the safe kind. If it's bad, just don't use it. It's just that simple. We've got other stuff that's a whole lot safer, so we'll just keep using it. And that rock should keep moving. Don't sit and don't lick your hands when you're done. So anyway, all right. So W.D. Miller came up with his ideas about periodontal disease and microorganisms of the human mouth about the time that my granddad was graduating from dental school in 1898. They both went to the University of Pennsylvania. My granddad was the first Kennedy to ever get a college degree. And so he primarily removed teeth, and he was good at it too. And then Charles Bass was the first person to carry a microscope west of the Mississippi. He was not a dentist, he was a physician. And he was the youngest man at 27 to be the dean of a medical school, Tulane. And he published the Bath method of brushing. And how many people here have heard of the Bass brushing? You're supposed to aim the toothbrush at the gums and then wiggle it back and forth or in a little circle or something like that. Well, how many people know that you can't do the Bass brush technique with an Oral-B? Well, that's what Dr. Bass determined. He tried to get the organisms out of his gums because he'd used a microscope, figured out what the bugs were, and he tried to get them out with an ordinary Colgate, Oral-B, whatever you want to call it, but he couldn't. And the reason he couldn't, and you have in front of you a toothbrush, I want you to take it out of its little wrapper. And now you have a toothbrush that's out of the wrapper. Some of you are in boxes, you're going to have to work harder. That's my friend the film nut, Paul Wittenberger, gave me those. I was running a little short. And so what Dr. Bass did is he took a toothbrush, roughly the equivalent of Oral-B 60. He ground the head of it in his shop and rounded the head so there's no sharp corners. He polished the bristles like Oral-B does because there's now polished in bristles. And he pulled out 2/3 of the bristles. And he did that in different patterns, and he came up with this pattern. And this pattern, if you look at it, it has 3 rows of bristles that go vertically down in rows. But if you turn it sideways, they're not parallel. Is it you can't see between the bristles? Is it they're not parallel both ways, they're just parallel one way? And the reason he did that is that when you aim it at your gum to do the Bass technique of brushing, it digs in the gum. It digs in about 1/4 of an inch, and you can dig around in here, and if you get any pink out of there, you're going to have some of our little friends. I'll show you what they look like. But you should be able to dig around like this, and you are not going to hurt your teeth with a toothbrush. It's the toothpaste that hurts the teeth. And it's the saw motion. So if you feel like you're trying to cut a tree down, I got to tell you about the time I went to Alcatraz. No, I wasn't in there on purpose. I went there as a tourist. And they showed me the area of the prison that they had banned any prisoners from being there because one guy got out. And how did he get out? He got out by using his dental floss. He took his dental floss and his toothpaste, and he did this day in, day out. You got a lot of time when you're in prison. And so by doing this day in, day out, he was able to cut through the iron bars in Alcatraz. And so they'll show you that area where you can't lock people up if you give them any dental floss. And so they came up with another thing called steel. And so they locked them up in the steel bar area. But so that's what wears away teeth, is repeated motion with a little bit of grit. So the solution is saliva doesn't have any grit, does it? But in your saliva are all the minerals. We were talking during the break about the minerals that your body needs. Well, for some reason, I don't know, God put all the minerals in your saliva that your teeth need. What was she thinking? And you can feel that if you drink a Coca-Cola, your teeth get kind of fuzzy. And that's because it etches the protein and stuff out of the surface of your enamel. And you slop your tongue around for a few minutes and it gets unfuzzy again. And that's because that's mineralization, demineralization, remineralization. It's a normal process that goes on in everybody's mouth every day of the year. And you can accelerate it with certain things such as cheddar cheese, or you can buy the MI paste. Don't get the kind with the fluoride. Or you can just use saliva. And so I have a Lexus. It's got 3 little holes on the left-hand side of the dash, and I've got 3 different color of toothbrushes there. And people say, well, how do you sterilize the toothbrushes between use? And I said, I let the sun hit it. Because germs can't live in sun. They don't have skin like you do. So they get out inside Austin, they die. So then all of a sudden, you've got all these brushing stations. They say STOP. And so you stop there at the brushing station. There's a red thing. and sit there and hack at the brush, hack at the teeth. And that always use the red stuff to tell you where the spirochetes are living, because you don't want spirochetes in your gums. It's not a good idea, because if they're in your gums, they're in your bloodstream. So I do not understand why, well, I do understand, but I don't think it's appropriate, that we can identify a tool that's as simple as this. The U.S. Navy bought these kind of brushes for 10 cents. Or you can get them from the manufacturer in Oklahoma. There's only one manufacturer of the right kind brush. When Dr. Bass died, John O. Butler rushed up to the widow and said, wouldn't you like the right kind brush to be available to the profession? She said yes. So they bought the name Right Kind, and they started making a brush that's parallel two ways. So they started making the wrong kind and calling it the right kind. Is that funny to you? It is to me. Anyway, in Tulsa, Oklahoma, the name of the company is on here, is POH. They don't give me a commission, although he's driving a very nice car because I've bought it over the years. But you might ask Mr. Jones, who owns the company, how come the funny little toothbrush company in Oklahoma makes Dr. Bass's brush? And the reason is his father was a periodontist. Back in the 30s, went and worked with Dr. Bass. And Dr. Bass at the time was using his lathe and grinding the toothbrush and using his pliers and pulling the bristles out and showing everybody else how to do that. And he bought toothbrush manufacturing equipment and set up his own toothbrush company so he could have toothbrushes and he didn't have to spend all afternoon grinding these things down and pulling the bristles. And everybody should have a large stock of these, and because, especially if you treat children, because children, you want them to get to say yes. And so the first question you ask a child is that when they get in the chair and they're a little nervous and they're kind of looking around to see if there's anything sharp that might poke them anytime soon, and you say, oh, do you like presents? And if you don't get a yes, you say, I can't treat this rat. Anyway, but if they answer yes, and then you say, you take a handful of these with 4 different colors and say, what color do you like? And they'll pick a color and they say, do you know the toothbrushing song? No! Oh, I got to learn the toothbrushing song. So then you get to brush their teeth. And then using a bass brush and singing the toothbrushing song. You know the toothbrushing song, don't you? Brush, brush, brush. I love to brush my teeth, keeps them clean and white so they stay in tight tonight. You laughed. You're supposed to. So anyway, I don't think Dr. Mass knew the toothbrushing song, but he did know what causes tooth decay and gum disease. And so I'm going to go show you a little bit of what's going on here. Here's what happened to the human beings that lived on this planet not too many centuries ago, but before the indoor plumbing. So if you can just roll your head back to the time when we were walking around the woods with a bow and arrow and a hammer to knock something in the head and take it home and cook it, that these people developed terrible periodontal disease and that their teeth wore out. And so did they. Is that basically gum disease is the principal problem that cost them their life. And that you can see this gentleman has lost almost all the upper teeth. Average age of this skull was estimated at 38 years old. And you can see that the lower molars are still in the jaw and the upper molars are lost. And that's basically the same pattern you're going to see in your practice, with the maxillary molars are the ones that are mostly affected by periodontal disease more rapidly than the lower, and it has to do with the density of the bone and how quickly the bacteria can eat it. So it takes them about 38 years, unless we do something to stop them. And so what the attack has been on for the last 60, 70 years has been since my grandfather's time. My grandfather's time was, if you had gum disease, take the teeth out. And Granddad's philosophy was smooth gums or healthy gums. And so I probably killed him. He only lived to be 93. But I never knew him to have any teeth. He always had them in his pocket. And he's a dentist. But he'd put them in to smile and eat and stuff like that. But or stick them out to scare the grandkids. But that was the solution. And what he learned in dental school, and probably correct, is if you had gum disease, you're going to have heart disease. And he didn't want to have heart disease, but he had gum disease, so he got rid of his teeth. Okay? It's a choice that he made. And so These people didn't have that choice because they hadn't invented pliers yet. And so here's a fellow that's in his 90s that has the fuzzy stuff on the tooth. The fuzzy stuff is the stuff that causes tooth decay. And so that's not what caused the bone to be lost around the tooth. So the reason I showed you those other slides is gum disease is not gum disease. It's bone disease. And it's caused by these guys. See the little snakes? They're spirochetes. And up at the top of the screen is a red blood cell, and the spirochete eats his way in and then gets stuck inside, and then he eats his way back out. So bacteria that can eat holes through stuff are pretty aggressive, aren't they? So that is why the bone was lost. You can wear into the nerve canal by eating stone ground acorns. So the staple in this man's diet was acorns, and that it wears the teeth out. And so when you're in the store, you can get the stone ground flour. And there's always a little bit of granite in stone ground flour, and it has good minerals for you, but it does wear your teeth out. And so people lived about as long as their teeth did. And so here's what happens when they get into radicular periodontal disease. It's called a Furca involvement. And this was the youngest skull that Dr. Tyson at the Museum of Man showed me. And she said, the first thing she said it was a girl. And I looked at the face and I said, it's an awful ugly girl. And so she looked at the pelvis and she said, no, it's a man, but it's a little bitty man. And that he was healthy till he's about 12, and then he got sick and well and sick and well and sick and well, because your bones are like a tree ring. It shows you the life of the person. And so this fella apparently was injured when he was about 12. And that he ate on one side of his mouth until he wore out his first molar. You can see he's worn into the pulp canal on the first molar, and it abscessed, and then he couldn't eat on that side, but he couldn't eat on the other side because the TMJ was frozen to the skull. So you basically lived only as long as you could chew something up. Now we got McDonald's, so you can eat that with your lips. And then here's my granddad would be happy. Here's the old man in the tribe, and he was a professional man. She says he was either an arrow maker or a basket weaver, because see how his teeth don't fit together, and that's okay. You'd grab the reed and split it and weave it into a basket or the leather and make an arrow head, attach it to a shaft. And I asked her if they had cleaned his teeth, and she said no. We wrote San Diego Museum on it, but we didn't, treat the remains at all. And I said I'd vote for basket weaver, because you see how clean those teeth are. Is that business wasn't that good, so he'd sit there and poke in between his teeth and knock the gook out from between his teeth. And there's a little bit of silica in grass. And you can actually look at the scratches on the enamel and determine what kind of reed the gentleman was using in between his teeth based upon the microscopic scratch on the enamel. So you can clean your teeth with a lot of different things. And, a reed will do it. Did you notice any orthodontic problems in those remains from the past? And that if you go through 1,000 skulls in any museum in the world, you will find no crooked teeth, unless it's a high fluoride area. When Betty and I filmed our documentary in China, the only crooked teeth we saw were in the high fluoride area. So when we talk about the consequences of inhibiting MMP20, are there other consequences besides funny-looking teeth? Well, yeah, funny-looking jaws. And so much of the growth in orthodontics with retained baby teeth, teeth coming out to the side in buccal version or lingual version, are a direct result. We see that in horses. In Kathy Justice's horses, if you look at that documentary called Poison Horses, there's an adult horse that's still got baby teeth. And that's one of the symptoms of fluoride exposure in animals, and I think also in humans. So we're crippling the growth and development of the children. So The old paradigm on gum disease was that there was something wrong with the tooth, so we need to scrape the tartar off. I call tartar bacterial condominiums. So we were basically wrecking the condominium. The thought was that we could treat it with antibiotics and disinfectants, and we would lash the patient with dental floss. You haven't flossed enough today. You haven't flossed enough today. You haven't flossed enough today. And then if you didn't floss enough, we're going to cut your gums off. I do a gum circumcision. We're going to straighten you right out here. And so, and that Bob Barkley was trying to teach us in terms of communication that whenever you allow yourself to say the words should, ought to, or must, you are being a parent. And you may have had a really good relationship with your mom and dad, but if they told you that you should not speed, if they could not see the speedometer, that you had to learn for yourself exactly how fast you could go, because there's another parent over here in a black and white that's going to stop and talk to you about what you should, ought to, and must do. So as long as you have the highway patrol to enforce the should, ought to, and must, then you're fine. So if we wanted to hire the plaque control people and have them go around and check and make sure that people are flossing, we can use that approach. Unfortunately, the should, ought to, and must approach requires enforcement. So you have to have a whole army of black and whites out there to enforce the should, ought to, and must. On the other hand, if you would like to empower people so that they can, might, or able, then the other words that you use are ones that are person to person, and you allow people to choose health. If I had this problem, I might recommend that we were to remove the organisms that are causing the disease. To do that, I would irrigate. Oh, so all of a sudden you got rid of the wagging dental floss and became a partner. And so you don't want to wag the dental floss, because then you got to put the hat on and the red and white and blue lights, and then you get the black and white car you got to enforce it, and so it doesn't get enforced. The public understands that we're in a dichotomy right now, and the people you're seeing are not the poor people in the world. Even the people on welfare are not the poor people in the world. That the people that you're seeing are people that have chosen to have oral health care, and so you're already up in the 50% of the population right there. And if you're into some of the things that I'm going to talk about, that you're into the people that have really chosen health over the disease model that our society is so enamored with. Heart bypass operations instead of nutrition, chemotherapy instead of avoiding cancer, et cetera, et cetera. And so they're looking for stuff that's green, natural, integrated, and self-administered, non-surgical, non-pharmaceutical, and non-toxic. And so that drove people to my practice for 30 years. It'll drive them to yours. Because the public decided almost 30 years ago that's what they wanted. So I can't tell you how many ups and downs that people have had in practice in San Diego. One of the toughest dental markets on the planet, and we were busy. And, I'm not bragging, but, what we offered was not available. I get people all the time saying, still in San Diego, they get dentists that insist on doing fluoride treatments on people that know that they don't want it. So that is the Nazi in dentistry. Is it because we went to dental school, we know more than the person in the chair? Well, you know what? That's not true. We just think we do. And that's when the wagging finger comes out, and we're going to tell them what we learned in school. Well, I've already shown you a couple of the things we learned in school were just total malarkey. So listen to the patient, figure out what they need, and offer them the opportunity to choose oral health. And it's biological train is not the same as immunity. Achieve a train inhospitable to infection, and we've talked a minute ago about some things like MI paste, the irrigators that we can use with iodine and stuff like that, hygiene with plaque. How does that spirochete live? It doesn't live by itself. Because of that gook on the top of the tooth, keeps oxygen from getting down in the gum. You've got to have the combination of all of that. The gook eating up the oxygen so that the spirochete can survive. So that's what it means to make it inhospitable to that kind of disease activity. Habits such as I carry toothpicks around in my pocket because I learned from a patient. I had a lady that came down to my practice from San Francisco. Her periodontist sent her down to see me. And because she'd moved to San Diego or closer to her family. And she'd had terrible periodontal disease, and he'd done all the usual things. He'd basically recontoured all the bone and cut the gums off, and things had continued to progress downhill. And finally, she said to him, she said, "What will it take to stop this disease?" And he said, "Well, you've got to get rid of all those organisms." And she said, "Well, how should I do that?" And he says, "I don't care." And so she developed what he called gum grooving, where they took a toothpick, broke off a ½ inch of it, so that she had maybe at the most of a ½ inch of toothpick sticking out of her fingers. And then she would take and draw a circle around each tooth, up in between, down, around each tooth, up and down. She says, "You know, they squeak when they're clean." And she would rub at them till you could hear it squeaking. And if you don't believe me, sometime when you're watching some boring TV program on Fox News, you can sit there and rub it till it squeaks, and you go like, "Huh, squeaky clean. I see what she's talking about." And you just keep poking at these things until they get squeaky. And she said, "Would you like to see how I clean my teeth?" And I said, "Yeah, show me." And she took this little toothpick, broke the end off, and went around every tooth, and there was not a scrap of plaque. I got a microscope I'll show you in a second. There wasn't a scrap of plaque I could even get a sample of. She cleaned her teeth perfectly with a little teeny piece of wood. Of course, remember, she looks kind of like a skeleton with the long teeth because they cut all the gums off. But she also had no gum disease, and her bone loss had stopped completely. So, hey, if you can do it with a stick, now you have Dr. Bass's brush. So, how many people realize we had a challenge one time to Jürgen Slotz was talking at our academy, and one of the peer reviewers for the continuing education credit says, "Well, viruses don't have anything to do with gum disease," apparently quoting something he'd learned in 1950. And so Jürgen Slotz has published a number of papers on the herpes virus, which has a lot to do with gum disease. So we had to educate the peer reviewers, so that brings a new focus on what kind of peer it is reviewing our work. So anyway, we're dealing with bacteria, and most people think of tooth decay and gum disease as a bacterial disease. But clear back in the 1919, Dr. Bass identified a parasite, an amoeba. And I wasn't able to sample the amoeba very well until Trevor Lyon spoke to our academy about what the amoeba wants to swim in. It doesn't want to swim in the salt solution that you get with your microscope. It wants to swim in saliva. So take a pair of cotton pliers, bounce around Wharton's duct, and you'll get a nice drop of saliva between those tongs. Put it on a slide, open it up. Now you got a drop of saliva. That's what it wants to swim in, and it wants it nice and warm. So you put it on the microscope and let it warm up, and you'll see amoebas. I'm sure you will, in advanced cases. Dr. Bass and I agree. The amoeba did not cause gum disease. How do we know that? It was not there at the start. If there is a disease vector, it has to be at the beginning as well as the end. So it's not, it's at the end. So what is it? It's a late opportunistic invader. So after the periodontal disease progresses with the spirochetes eating away the bone, so that you get down to a deep anaerobic situation where the white blood cells are coming out in droves, the amoeba comes in and eats white blood cells. And that just drives the immune system crazy, and you end up with the teeth that look like the people 500 years ago, with wobbling in the breeze. What's interesting, and I had the opportunity to do this on a young man, or do this with a young man, he broke his neck when he was 17. I never saw him until he was 34, and you could have removed every tooth from his head with your fingers. He had all 32 teeth. All of them were mobile. Every tooth had pus coming from around it, and there was no bone anywhere. And you could probe around. You know how bone doesn't grow back? That's not true. So I probed all around, and there was no bone anywhere. And so we told him he was hopeless, and he said, "I've heard that before." And so he wanted to go through the program, and the only person I've ever seen that was all spirochetes. I've seen, and you'll see the thing in a second, you've seen different kinds. He was all spirochetes. And you could not parallel park another one. If you're looking for a parking place, you wouldn't find a place. It was just full of spirochetes. And so we killed him. And we treated him one time with deep irrigation. She went around to every tooth multiple times. And if you want to know how to train a new hygienist, get a microscope and tell them, take a sample when you're through disinfecting this mouth. We don't need one to begin with because I've already done it. It's right here. You can clip a little video and show them. And all I want to see is one where it's all done. And it's the most humbling experience that I ever had. Because I thought I was pretty good. And if you start checking your results with a microscope, you'll discover that ego got in the way. And there's no bacteria alive when you get done doing a good irrigation. I've seen hundreds of patients come from periodontist's office just having had their teeth cleaned with all kinds of crawlies. And I just love video microscopes because now you can snap a little snippet and send it back to the hygienist and say, isn't it your policy to get rid of these guys? Where'd you get that? Out of the patient you just got through treating. So the weight of the evidence points to the strong likelihood Amenta amoeba gingivalis being the primary periodontal pathogen, and I disagree with that. That's Trevor Lyon's book. And the reason I disagree with that is because of Dr. C.C. Bass, because it wasn't there at the beginning, but it's certainly there at the end. So when I use it is the primary periodontal red flag. If there's amoebas there, they got to die. And you're not going to get it by squirting it with chlorhexidine or chloramine T or zinc chloride or hydrogen peroxide or iodine. Is that all of those things kill the amoeba, but the amoeba is not limited to living in the gums. So you can't squirt chloramine T in the bloodstream because you're going to kill the patient. You probably can give them some iodine, but probably not at a level that kills bacteria. You definitely can ozonate them, but getting enough of it in the gums and the bloodstream to kill an amoeba is probably a lot. So I typically used antibiotics, and oxalic used as herbal detox. Both of them work. So natural treatments that never hurt anybody are stuff like magnesium sulfate. Anybody know what that is? Epsom salts. You can get them at any store. They're really nice to take a bath in. Calcium, potassium chloride, sodium chloride. Those are light salt and regular salt. Any kind of salt water. Salt is a metal hooked to an inorganic molecule, so there's lots of them. There's several, potassium acetate. The Gerson therapy, they worked out a 3 potassium salts that Dr. Gerson recommends the patients take every day. We put them in an irrigator, and it's just beneficial. It's not harmful. We don't have to use toxic substance to kill bugs. Why does salt kill bacteria? They don't have skin. You can go surfing. You don't die. Well, unless you get wiped out. But bacteria don't have skin, so it dehydrates them. So you're using a very benign, slow-killing method to dehydrate the bacteria. Iodine kills them faster. There's lots of people that have different kinds of herbal detox that you can use. A lot of the oils, like oregano oil, tea tree oil, are very antibacterial. Colloidal silver, I don't recommend people swallow it, but it certainly does a good job of killing stuff. And aloe vera juice and belly, I think that's jelly. Anyway, ozonated gas, and what would an aloe vera belly look like? I don't know. And bentonite clay, all these things are effective antibacterial agents. So when people say, oh, I'm going to use, so why in the world would you be locked into one thing that kills bugs? And it actually doesn't even kill bugs, just makes them sick. Why do we think that fluoride is the do-all, the end-all, when it really isn't? And the reason is because they've spent hundreds of millions of dollars to indoctrinate us. So I call dental education indoctrination rather than education, because it's not about the truth. If it was about the truth, you'd have learned about C.C. Bass and Dr. Kai's and the organisms that cause tooth decay and gum disease. It's about maintaining the status quo and teaching you to do everything the same way everybody else did so that you don't step on your neighbor's toes. We were talking at lunch today about one of our members who is one of the early adopters of laser dentistry. And lasers are another way to kill bugs, another way to remove tissue, another tool in our quiver that works very well. Particularly nice to fry a hole in a tooth that has a little rotten spot, and then you can flow in some of those nice flowable composites and bond that thing together. You never know there's a hole there. So the periodontists were angry at him because all of a sudden he was able to treat the bugs that cause gum disease with light. Oh my God. He can treat them with light. Oh my. And that was cutting into their business. So greed and self-interest are the primary motivators of many in our profession, and it's not my motivation. I'm taken care of because I'm doing the right thing, and people beat a path to my door and reward me generously. I don't have to fight for that. I have to fight to keep my skills up so that they realize that this is where they go to find that kind of care. But I don't have to cut down my neighbor. They'll come to see somebody that's not using toxic substances because they've already chosen green. They want that kind of care. So diagnose before you treat. And you know, I see so many dentists that are I call them cherry pickers. And being from Kansas and past life, that I know what a cherry tree looks like. And you go around and there's some really good looking cherries on the tree. And so you take the really good looking one, you leave all the rest on the side. And that's exactly what happens in most dental offices. You see that broken tooth and that's got to have a crown on it. So you make them a king, but you leave all the rest of the stuff undone. So if you don't get Dr. Bass's brush out, look at the organisms, get rid of them before you start putting restorations in the teeth, they're going to fail. It's because what God put in there failed, what you're going to put in there is going to fail. So Dr. Bass, you can see here he's working on a model. He was kind of a crusty old individual. He didn't put up with too much BS from dentists. But he showed anybody that would come down and sit and study with him exactly what caused gum disease. And this is the brush I just gave you. 3 rows that are staggered. Dr. Kais figured out that strep mutans caused decay. Now, he figured that out in 1960, I'm sorry. I misspoke. 1960. Most of you weren't born yet. And so what part of your practice has implemented that discovery? For thousands of years we've had tooth decay. He figured it out. It's caused primarily by a bug called Streptococcus mutans and a little bit by lactobacillus. So what part of your practice has implemented that scientific discovery? If you don't have a little tube that the kid can spit in and measure their strep mutans, then you haven't implemented Dr. Kais's, this is Kais, this is tooth decay. And so the next thing he looked at was he looked at what bugs cause gum disease, and that's the ones I was just showing you a minute ago, the spirochetes and the gliding rods, and that they're all motile organisms. And you don't have to be a great microscopist. Is that the bad bugs move. The good bugs are the ones that rot the teeth, or they're benign. So you have to measure the ones that rot the teeth by spitting in a tube, a chemical assay. The ones that rot the gums, you look under the microscope. If it runs away and tries to hide, it needs to die. It's just that easy. My assistants loved it when I took a sample because I'd sit there and talk a little too much, and so they'd get over and look on the microscope. And I taught them not to say anything. Biggest trouble is that, you know, when you're looking at bugs and stuff like that, you're talking about an intimate part of somebody. And so you don't want people coming by, oh, look at that one. Whoa, where'd you get that? Had one lady that had just a wall of amoebas, and she was just full of amoebas, and I said, oh, that's a good one. Where'd you get that? No, I didn't. But so I asked her if we could treat the amoebas, and she said, oh, I've had amoebas since 1967. And it's interesting you should know that. And she said, oh, I was in the Peace Corps in Africa, and I became infected there. And and I said, well, you know, there's an antibiotic that was invented about that time that would kill amoeba. And she said, yeah, metronidazole, flagyl. She said, I've had that 6 times. And I said, where did anybody give you the same antibiotic 6 times? She said, the United States Embassy. So in Africa, they kept giving her metronidazole. And I said, well, you mind if we do it one more time my way? And she said, I'd be happy to get rid of these things. And so we put the metronidazole with a little aloe vera gel. I'm in San Diego. It grows all over the place. So I cut a leaf off an aloe vera and scrape it out to make the gooey. And I took a tablet and I put it in my grandfather's mortar and pestle and ground it up with the aloe vera and made some goop. And the hygienist took and stuffed this tablet down around the gums of every tooth. After we'd cleaned, we'd go through and scrape all the gook off, not the tartar, but the gook. And we flush them out with the irrigator, and then we stuffed the metronidazole down in the pockets. And then she took it orally for a week, and she came back the next week, and we did it again. I had to do her twice, so I ended up with 2 weeks. She's one of the few cases that we had to do her for 2 full weeks, because I always use low dose. If you took all the amoebas that are in somebody that's been infected since 1960s, you could put them all together and have a nice, pretty good-sized mouse. Well, I remember in our house in Kansas that a mouse came in the house and died. That house stunk for a month. You know, all the rotted mouse, we could not figure out where it was. It was up inside the couch. But it had crawled up inside the couch, and that house stunk for a month. We could not figure out where that rotten thing was. And, well, what smells about a dead mouse is the sulfur coming out. And so what if you killed all the amoebas today? If you had a magic gun and said, amoebas die, boom, well, they're going to be sick because their body is going to be full of the decaying bodies of dead amoebas. They're animals, so that you're going to stink. And so it makes people really sick if you give them a lot of metronidazole at once, especially if they're infected with parasites. So I always use the low dose, the 250 milligrams, and then pack it around the gums and have them take it orally, and then pack it around the gums again. And if by the time we're up to the last day, if they can take that metronidazole and they don't feel ill at all, then all the amoebas are dead. That's a good thing. You just don't want to kill them on the first day because they'll think they're dying. So anyway, let's implement some of the things that Dr. Kai has learned. Is that all the bugs that cause gum disease move. They're not stationary. They're moving. So you don't have to be a great microscopist. You just need to learn how to put a drop of saliva on the slide and put a cover slip on it and squash it out real thin. And then you look under the microscope, and if it tries to run away, then you put something on it that dies. And then you look again. Bob Barkley was the guy that taught me about the Bass technique, and unfortunately, he only got to talk to a few dental schools before they figured out that this was a problem. The dean of our dental school was a guy named H.B.G. Robinson, and that if you ever passed the California Dental Board, you studied a book that H.B.G. Robinson wrote called The Color Atlas of Oral Pathology. And that's actually where they got the slides from for the California Dental Board exam, was out of Dr. Robinson's book. Very famous pathologist, and made it all the way to the top of dentistry, dean of the dental school with 400 and some odd dental students, yada, 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 yada. Bob Barkley talked when I was a freshman in 1967, and that he talked about what I've shown you today, plaque and spirochetes and CC bass, showing you can get the bugs off the teeth, and we'd never heard that. Because you know what? Dental schools didn't teach that. That wasn't important. They didn't even know about flossing. This isn't that long ago. And that they were teaching the Stillman's technique, brush down on the upper, up on the lower. How would you like to clean your fingernails? Brush from your knuckle down to your nail, brush from your knuckle down to your nail. You think you get the mud out from underneath your fingernails? Doesn't work that way, does it? So we sent our class president, Steve Hott, down to see Dr. Robinson and asked if what Dr. Barkley had shared with the all-student assembly was correct. And H.B.G. Robinson, he said there were little flecks of spit flying out of his mouth, as he called Hott, a lifer in the Air Force, by the way, a student radical. You think there's something wrong with the brain of somebody that doesn't recognize the difference between an Air Force officer and a student radical? Well, why was he a student radical? Because he wanted to ask a simple question. Remember when you tried to ask questions in dental school and they barked at you? You know why? They didn't know the answer. And neither did Dr. Robinson. He was in the dark as much as the freshman students. So that's how they shut off discussion in dental school, because they don't want discussion. We on the other hand, encourage discussion. And so at the end of today's lecture, we are going to answer all of your questions, including what can I use to treat gum disease and tooth decay besides fluoride? So it's just as simple as this. And this works for tooth decay, gum disease. It'll actually work for a dozen different diseases. You can, all the way from hemorrhoids to heart attack. A, identify the cause. Is it nutritional, bacterial, environmental, mechanical? Treat the cause. Teach the patient how to avoid aggravating the condition or avoid causing it again. And then together, you guys figure out how to watch the results. And that's your microscope or your strep mutans test. That is what the public is demanding. And that is what you can offer. And they will come to you from Hawaii to New York because they can't get that locally. And the reason is they've gone to an accredited dental school that's more into dogma and tradition than teaching people to treat the cause. So the thing that I run into all the time is that people are resistant to buying a microscope. And I shared that resistance because I could tell with my periodontal probe and my bleeding on brushing and that sort of stuff whether or not I'd done a good job. And so I basically did the Kai's method from 1978 till 1983 using the Kennedy method, which is kind of a half-assed approach that sort of tries to kill the bugs and pretend you did. And so my friend Jim Knott, who was actually a very good friend, and his father had been a physician in Ethiopia in the 30s, and he had a beautiful Zeiss microscope, just a regular old light microscope like you had as a student microscope. You know, the student microscope you used in school is probably worth maybe $50 on the used market. Probably cost new $150, $200. So these are really, like C.C. Bass was sitting there holding a microscope. Well, that was the microscope he'd carried west of the Mississippi. And so it was, you know, just a regular old microscope. It's nothing fancy. It's not a my final microscope was the Nikon $7,000 digital video microscope that would record and put it over here on the hard disk and send it off to other people. But you don't need that to start. You need something that you can look through. And my friend Knott got tired of telling me, he must have told me 627 times, Kennedy, you need to look at the bugs. And I would come up with all these excuses, like, well, I can tell by this, or I can tell by that, and I can tell by this, and I can tell by that. And he said, well, Kennedy, you need to look at the bugs. Well, I can do this, and I can do that, and I can do this. And Kennedy, you need to look at the bugs. So finally, Jim, God bless him, he got frustrated with me because I was so stupid. And so he brought his father's Zeiss microscope in this beautiful mahogany case with little brass corners. He'd carried that all the way through Africa in the 30s, and it was in pristine shape. He set it up, and he said, Kennedy, you need to look at the bugs. And so I thought, oh, I'll make him happy. I'll look at one of my successful cases. And the first thing I saw was a spirochete. Well, it doesn't take a rocket scientist to know that you're not supposed to have spirochetes in your gums, whether you think you've treated it successfully or not. And you know what? You cannot kill a spirochete with dental floss unless you whip it to death. And since there are a million of them, you're not going to get them. So microscopic biological sample is very important. I can't overemphasize that because once I got one microscope, I bought two more, and then I bought another one. And I've probably been responsible for another 150 people buying microscopes, and none of them have been sorry. And what I tell you to do is that if you want to be really cheap, and I am a very cheap person, is to get on the internet and look, because there's gobs of microscopes. The industry's throwing them away all the time. I have a friend that bought a bunch of them for $50. They're calibrated video microscopes. And he said, well, it's not phase contrast. Well, you know, so what? You can still see them. So what would it take to make it phase contrast? Well, you got to buy this $100 condenser. So you buy a $50 microscope with a $100 condenser, or $500 and $600, whatever it is. It's cheaper than the first case you're going to treat, for heaven's sake. Don't be so cheap. So anyway, it's a good idea to have some way to tell if you've done a good job of treating the disease. And so the first thing you do is you get a microscope. And on your periodontal probing, let me tell you that the Academy protocol does not have you probe until you've disinfected the gums. well, there is a paper we've got. It's called the Prevention of Bacterial Septicemia. And this is one of our many lectures, is that did you know that 100% of the wisdom teeth extraction, you will find a shower of bacteria to the bloodstream, large bolus shower of bacteria to the bloodstream, and that in the majority of applicating rubber dam, you send bacteria to the bloodstream. Invariably, when you brush vigorously, you'll send bacteria to the bloodstream. If you do a deep scaling or even a cavitroning, you will send bacteria to the bloodstream. And just ask your patient, oh, by the way, I'm going to manipulate some of the virulent pathogens that I suspect are around your gums, because I see that the gums are a little puffy and they do bleed when you floss and so forth. So I'm going to send them all down into your bloodstream for you. Is that okay with you? And that if you just bear with me for 5 minutes, I can prevent that. Would that be better? Oh, we can prevent that? Well, yes. This is the same that Semmelweis said. Wash your hands before you deliver the babies. Wash the gums before you start manipulating them. So whenever I could, just to simplify my life, I like to have the patient have a recall cleaning or a treatment where the hygienist disinfected the gums, and then sometimes even anesthetized the area that I was going to work. And so all I had to do was put the rubber dam on and do my magic work, and I'm done. Woohoo! No bacteria in the bloodstream, no people calling you sick, no abscesses afterwards, yada, yada, yada. Why don't we clean the gums before we work on them? Is because the old claim was you could not prove that this manipulation of my gums had produced that bacterial endocarditis. And that was before DNA testing. Now we got DNA testing. And we can prove that caused this. So let's stop causing that. So periodontal probing, that when you take, Bill Landers gave a lecture at the Academy, and it's on our website. It's called the sharp ruler method of diagnosis. And so a periodontal probe is basically a wire with notches on it. So it's basically a sharp ruler. And so he's saying taking that and poking that around the gums is you're basically identifying where the bacteria have eaten big holes. And since the bacteria ate the hole, the likelihood is that you're taking this sharp ruler, or needle as the patient would call it, and poking it into the bone below that. So you're now seeding the organisms that are in the crevicular fluid into the bone and into the bloodstream. And so we don't think that's a good idea. So what we encourage you to do is, after the hygiene appointment where the mouth is disinfected, then you create your periodontal chart. So then you can measure the gums when they're not carrying bacteria into the deeper tissues, and you try not to push hard enough to go past the skin. But when the skin is turned into pudding, sometimes that's not possible. So shortly thereafter, though, you'll find the skin grows back. It takes about 7 days, and then they'll have skin there. But disinfect the gums before you measure it. Eyeball it. Look for bleeding, bad smell, culture. You can culture. Some people like to culture. I don't see the reason to spend $150 to find out, that there are bacteria there. And DNA testing is $250 or something like that, and you can check it with BANA. So there's lots of ways to measure it. And this is what I thought I was so good at: heat, pain, redness, swelling. Oh, I can tell by that. That's not true. I can tell by this. Little old microscope. You can take a sample, put it out, and you look for purulence, as in bone loss, and that the sample is saliva. You can't culture bacteria from the gums because they're anaerobes. So if you do, you have to make a nitrogen tent over them so you can get them out without exposing them to oxygen. So when people say I do a culture, I laugh. Are you doing the anaerobic culture with the nitrogen tent? And they say, huh? So medical referral, that I like to work with physicians, and there are some really good docs out there that are looking for you. And there's some other suggestions that you can say, drink 4 beers instead of 40. Get rid of the mercury. Did you know that mercury is related to gum disease? That was one of the first papers. You hear it all the time. The shiners, the shits at the shiner just said that mercury from fillings is not related to any medical disorder. Is gum disease a medical disorder? Yeah. Well, if you take a person and on one side of the mouth you put a two-surface amalgam, and on the other side of the mouth you put a two-surface composite, and you measure the bone, you lose a millimeter of bone on the side that got the amalgam, you lose no bone on the side that got the composite. So there is a millimeter of bone loss within 6 months around the tooth that got the amalgam. Do you think that might be a beginning of bone loss around the tooth? And that Mike Ziff wrote a paper, I have it in my endnotes, I can send it to you, about the proven consequences of the use of mercury. And it was all about dentistry, all about peritonitis, all about bone loss. And that's what he actually documented in 1992 or something like that. So for them to still be saying it's not related, and it really is the same problem we've had since Dr. Bass discovered bacteria, or W.D. Miller discovered bacteria causing tooth decay and gum disease. We don't move forward. We're stuck in the 1800s. We've got to move forward. The public has moved on, and we can move on too. And so become a leader. Move on. And so as I talked about my friend, the quadriplegic that broke his neck, it's completely full of no teeth that would stay in his mouth if he'd sneezed. And but he didn't have money. Break your neck, you don't earn much money. And so his parents paid me to clean his teeth, and I cleaned his teeth 6 times. And we didn't actually clean his teeth. We just flushed them out with, I think back then I was using the chloramine tea. Chloramine tea will kill doo-doo. It's a chlorine molecule with an ammonia molecule on the side, and so the bacteria absorb it. Ammoniated iodine is the iodine version of chloramine tea. It could be called iodine tea because it's a tertiary amine, what the T stands for. So both of those will kill on contact all organisms. So we flushed his mouth out with chloramine tea 6 different times, and then he rolled away and I didn't see him. My program, as you can see here, is phase 1 for week 1, clean it, and then by week 3, you should not see any organisms. When you go to the microscope, you shouldn't be seeing stuff anymore. But we keep doing it. Week 5, week 6, week 9, and those are each time we clean the entire mouth. Anybody still doing quadrant scaling? Do you wipe half your ass? What are they thinking? This is a milieu of ick. You cannot clean a quarter of it. You can disinfect the whole mouth and go back and scrape it in one area if you want to, but you got to clean the whole area. Otherwise, the minute the toothbrush brushes around like this, they carry these organisms over here, it's back infected again. So it's full mouth disinfection every time. And that's what we did for him. We did him 6 times. And then I didn't see him. Because he's supposed to come back 2 weeks after, and I tell him not to brush the morning of for 24 hours and let me see what grows back up overnight. Because, the wolves coming out of the corners. I didn't see that. I missed that. He didn't have that appointment. He paid for it, but he didn't have it. I never saw him. 7 years later. Ready for my bug check? Oh, yeah. Still got some teeth? He said, oh, yeah. He still had 32 teeth. There was no pus, no mobility. Bone had grown back up around the apices of all of the teeth, no non-vital teeth, and no bugs. Perfect. And I told him, I said, oh, that caregiver, she's doing a great job with the irrigator, huh? And he said, oh, those ladies come through my life like a cloud through the sky. And I said, well, who's irrigating now? And he says, I haven't irrigated since 3 months after we were done. I said, oh, really? Didn't have any visible plaque. He said he'd worn out 8 interplaque toothbrushes. He doesn't have them do it. He does it himself because he said, I got a grip. I can't let it go, but I can grip it. But he said, it runs for 2 minutes. So I grind on this side, and that's the same angle in the Bass technique of brushing, angled 45 degrees down, as the inside of the lower left. So I do this side for about 60 seconds, and I do this side for about 60 seconds. Then I bite on it and swivel my hand 90 degrees, and that does the inside of this side and the outside. So he had his mouth all mapped out. He used that interplaque toothbrush for 8 minutes. I don't know what he's using now because I haven't seen him for 20 years, but he stopped gum disease And then he said the key, and he said, and I'm not swapping spit with anybody. We disinfected him, and he never got infected again. That potential exists in your practice, and what it does, it brings in the husband, because we can treat the wives, because they're a little more health conscious than the men. There's a website that says, women live longer than men, and that there's this aluminum ladder in the middle of a swimming pool, and the guy is up on the top of the ladder changing this big heliarc light bulb, and you know the juice is on because there's a row of 8 of them, and there's one that's out. It's like, women live longer than men. There's lots of men doing really stupid stuff. But anyway, the women have a tendency to choose better oral health care. And that once you get the wife disinfected, and she looks really good on her follow-up call and all that stuff, and then she comes back for her 6-month call, or 3 months, and she's got bugs again, you can say, where'd you get those bugs? Did you change your lover? I have one attorney that would bring his lovers in. So it's an infectious disease. I had to get one lady, let the dog quit kissing her. That fixed it. I said, is your husband got? Oh, he died a long time ago. I said, are you dating anybody? And he says, no, I'm by myself. And I said, you letting the dog kiss you? And she says, oh, little Pookie. I said, you know what he uses for toilet paper? So we cleaned her up. So, but I didn't tell her to quit. Didn't tell her she had to quit kissing him. I said, just come in more often if you're going to keep that dog in your face. Find the source of reinfection. Always praise, even if it's just a little bit better. Just like my brother said that there are no ugly women in Oklahoma. There are some that are just barely pretty. So, if the blood comes out, the bacteria will go in. So, you want to know how you're getting bacterial septicemia? If you get the red stuff out, there's a highway that the bacteria get in, and it causes heart infection. So, if you got mitral valve prolapse, that's bad. Well, you can have a perfectly healthy heart die from oral infections, and it also is linked to bacteria in the brain. It's called a stroke. Bad gums is low birth weight babies. Bad bacteria in your mouth is linked to cancer of lungs, pneumonia, and diabetes. So there's absolutely no reason I can think of why anybody would not want to get rid of these bugs out of their mouth. And that using the IAOMT protocols, that's really pretty easy. And so I have put this video up on the my website, and it's a training video that you're welcome to use in training your hygienist. And that if there's a hygienist here, that you can train yourself. And the key is take a sample when you're through disinfecting the mouth, because I can tell you from having looked at a few 100,000 mouths that there's bugs in there if there's anything wrong with the teeth. So if you look at the end, if there's nothing moving, that you've been successful in somehow in that, then that's really what you're trying to do, isn't it? Is to stop the bugs. So I think that is as far as I want to go. I want to show you a couple of things. This is a study from Ireland, and it's in the process of being published. It hasn't been published yet. This is raw data. And so one of the things that the Academy is doing is some of the better ways to look for subtle effects. And, people say, I haven't seen anybody die of fluoridation. Well, if you're using death as an endpoint, you have to give them 5 milligrams per kilogram. And we're not. We're giving them 0.25 milligrams per kilogram. So, the dose is below the dose that's known to kill somebody. So if you're using death as your endpoint, sure, you'll be successful. You could put arsenic in the water and you won't have that problem. Actually, we do put arsenic in the water because there's arsenic in the fluoridation chemicals. But what happens is we don't live for a year. Rats live for a year, maybe 2 years at the most. So when you're looking at somebody that's going to live on the planet for 70 years or 100 years, you got to look with big computers. like the Cray computers that take gobs of data and sort it out. So if you take the national health care from Ireland and crunch it through their computers, what you find is the areas of purple are the areas of high prostate cancer or leukemia of both sexes and pancreatic cancers of both sexes. And the green areas are the areas of virtually no or very low cancers of both sexes. So is there anybody you know that's died of pancreatic cancer? My mom, for one. So how about prostate cancer? I got 7 friends right now that got prostate cancer. So it's a terrible problem. But you don't see that by just saying, well, I didn't notice it. Did you look? And so this is what it looks like when you use data mining. And the advocates for exposure to fluoride aren't going to like data mining. Because here are bladder cancer in women, brain and central nervous system cancer, and what is osteopharyngeal? Is that oral pharyngeal? Esophageal? Esophageal cancer. Anyway, if you look at that, what you need to know to interpret that is that that little red line at the top separates Northern Ireland from Southern Ireland. And Southern Ireland is slightly less fluoridated than the United States. But it's the most fluoridated country in Europe, because none of continental Europe has any fluoridation. And there is one test going on in Spain still. But there was one in Kuopio, Finland. It stopped. East Germany, Poland, Czechoslovakia, all those have stopped since the fall of the Iron Curtain. Germany never allowed it. Finland, Denmark, Sweden, France, none of those allow it. About 10% in England. But Ireland's a good test because in order for you to leave Ireland, you either got to take a 7 to 12-hour ferry ride or buy a $300 airplane ticket. So nobody's leaving. So this is an island nation. It's a perfect place to study what happens when you drink the local water. And what you find is that you end up with a lot more cancer where you put silicofluorides in the water. And that's driving the advocates for fluoridation. There's actually a government program to encourage fluoridation. The really obvious one is in the males. And that one of the reasons that is that for reasons that are not entirely clear, is that males are more sensitive to mercury and apparently also more sensitive to fluoride. They should be less sensitive to fluoride because they have bigger bones, and that's where the body stores it. But anyway, Declan has done that, so I just thought you'd like to see those. I've passed out this postcard to you, and the way I got to make that documentary was I went into Betty's checking account and got about $100,000, and we put together, I didn't tell her, oh God, she's in the back. So anyway, we hired a film crew, and then I went back to all the people that had spoken to this academy over the years that were part of the Bill Marcus story. And everybody know Bill Marcus' story? So let me fill you in real briefly. Dr. Marcus, in 1990, wrote a memo. And who's Dr. Marcus? He is the senior toxicologist at the Office of Drinking Water at the Environmental Protection Agency. He's a big fat guy. He spends his entire life looking at rat studies and animals and this and that, and he loves toxicology. He said it's the best job any toxicologist could ever want, because he started out in medical school and he didn't like it, but he got into toxicology, he loved it. And so he got a job as the head honcho in the Office of Drinking Water, and it was his work that that identified chlorine as one of the causes of prostate and breast cancer. You heard that, didn't you? Oh, they didn't bother to publish that. They did publish it. 10 studies. One of his first things was he got to do 10 studies to look at and see whether or not chlorine in the public water supply was linked to an increase in breast cancer. You see all these people with the pink ribbons going around saying, oh, we need to stop breast cancer. I'd like to have a black ribbon here saying we need to stop prostate cancer. But so he basically commissioned 10 different firms to go examine whether or not cancer had anything to do with chlorine in the public water supply. And they went out and they mined the data and they took this and they did that and all of them came back and they all said yes, there was a positive correlation between the amount of chlorine in the water supply, because it varies dramatically between different water supplies, the amount of chlorine in the water supply and the amount of breast cancer and prostate cancer. And so he put them all together. So now he has 10 studies. He did what's called a meta-analysis. They had criteria that they had to comply to do the study, so he was able to combine all 10 studies. So now he's got a huge mega study, and it comes out with a p-value, which means the chances of it between, it's like the chances of this being an accident or someplace like a snowball in hell. It's got like four zeros before you get to the p-value. So it's happening. So what the EPA did is that they started requiring you to use chloramine T in the water supply. So we've got studies showing that chloramine T doesn't cause cancer? No, we don't have those studies. So instead of dealing with the fact that chlorine is linked to breast cancer, they just switched to a different kind of chlorine. Now we've got to do the same study again, don't we? Why don't we just identify the fact that chlorine's not good? And that's when I learned from Dr. Marcus that chlorine wasn't good, is when I quit using chloramine T in my practice. I didn't know that. Did you know that? Wife used to put chlorine in the washing machine, to bleach up the clothes. How many women have been exposed to chlorine all the time in the laundry, day after day? Oh, now it contains more chlorine. Well, you know what? You don't want to do that. That's not good for you. You want to expose yourself to more fluoride. Joking. So, Dr. Marcus wrote a memo in 1990. When the National Toxicological Program was ordered in 1977 by Congress to test fluoride to see if it's a carcinogen. There was a study at that time done by Dean Burke, the former head of the National Cancer Institute, Cytology Division, that found a dramatic increase in cancer death rates. That's different than causing cancer. There was a dramatic increase in the number of people who died of cancer in fluoridated communities over a 10-year period. 10 communities that were fluoridated, 10 communities that weren't. More people died of cancer. And so the congressional hearings ordered the National Toxicological Programs to study fluoride. So they did a 2-year study. And so if you were a government going to do a 2-year study and you started in 1977, what year do you think you'd get it done? Oh, that would be 1989. They managed to drag their feet for another decade. And in 1989, in the words of the Patel Laboratory, who were the people that got the contract, the high-dose animals were awash with disease. What horrible level of fluoride did they give these high-dose animals? These high-dose animals had 79 parts per million fluoride in their water. And they had cancer of their lip when they went over to get a drink of the water. Cancer of their tongue when it went by their tongue. Their throat when it went down their throat. Cancer of the liver where it was detoxed. Cancer of the bone where it accumulated. Lip, tongue, throat, liver, and bone. And so we think it's okay as dentists to put 1,000 to 1,500 parts per million fluoride in toothpaste in children's mouths every day, and to put an unknown amount of fluoride in varnishes that we paint in the schools without a prescription, and unknown amount of fluoride in pesticide residue in all our foods and beverages, and a huge amount of 12,000 to 15,000 parts per million in the topical fluoride treatment in our dental office, and that we always look for cancer. Well, great. So Dr. Marcus wrote a memo, and because what the public health department, why didn't Congress order the public health department to do the study? Because the public health department had gone before Congress and lied to them repeatedly. Craybill went and said, that study showing the increase in cancer death rates, we've got 3 studies that show that it just didn't happen. It's just that Dr. Burke did a terrible study. He's a bad scientist. He doesn't know what he's doing. We've done one from Harvard, one from Oxford, and we did one in-house ourselves. So there's 3 studies that completely refute that what you, Dr. Dean Burke, found with the increased cancer death rates. And Congressman Fountain said to Dean Burke, who was sitting down there chewing on a cigar, said to Dr. Burke, what do you think of that? And Burke, well, they haven't published them, so I haven't seen them. So until they're published, it's hard for me to comment. And so he said to Craybill, Craybill was the head of the NCI. They said to Craybill, he said, do you have those studies with you today? And he says, why, I sure do. And so he gave them to Congressman Fountain. Congressman Fountain gave them to Dr. Burke, and he said, Well, Dr. Burke, can you give us, how long do you need? And he said, I'll do it over the weekend. We'll do it on Monday. And he said, all right. So the committee's adjourned. We'll meet again Monday. So they came back in the committee on Monday morning, and they called the meeting to order. Thank you. Thank you. Dr. Craybill, please return to the podium and start. Remember that you're under oath. Yes. Good morning. Good morning. And you know there's penalties for lying to Congress, and that you're under oath. Do you acknowledge that? Yes, I do. Yes, I do. Well, last Friday you testified that there were 3 independent studies that refuted what Dr. Burke had found of an increased cancer death rate. Do you wish to change your testimony in any way? Oh, no. 3 completely independent studies. You didn't have anything to do with the studies from Oxford or Harvard? No, those are 3 independent studies. He said, well, add up this column of figures for me. He came up with the correct number of cancer death rates. And he said, well, that's interesting because that's the correct figure you got there. And that when you plug the correct figure into your formula and Oxford's formula and Harvard's formula, you come up with exactly the same result as Dr. Burke, a 10% increase in cancer death rates. But there's a mathematical error in all 3 of your studies. How do you explain the fact that Harvard and Oxford made the same mistake mathematically that you did? Oh, well, we furnished the data. So now Congress is faced with 4 scientific studies that all showed an increase in cancer death rates. And so that's why they ordered the NTP, National Toxicological, not the U.S. Public Health Service, Craybill's part of that, National Toxicological Program to study cancer and fluoride. And so Dr. Marcus wrote a memo, and he said, I think it's inappropriate, the changes to the findings of the Battelle-Columbus Laboratory. Because you know how I told you the cancer of the lip, tongue, throat, liver, and bone? The Public Health Service changed every single cancer that the Battelle-Columbus Laboratory pathologist found. Every single cancer was changed 2 levels. That means that if you had a lump in your breast and you went in there and they took the biopsy and it came out and the Battelle-Columbus Laboratory said it was a breast tumor, this one says, no, it's just a benign lump. There is a huge difference between what cancer looks like and what a benign lump looks like. And so Marcus had already had a pathologist look at the slides, and he said, no, those changes weren't correct. Well, Dr. Marcus sent a memo. He said, we need to have the pathologist from the Battelle-Columbus Laboratory review the changes to the slides with the U.S. Public Health Service. We can do this in-house. We can do it on a weekend. And they fired him. Why would they fire him? Because they can't have scientists look at the slides, because they show exactly what everybody knows if they pay any attention. So he sued them under the Whistleblowers Act and won with punitive damages. The government obstructed justice. They witness tampered. They interfered with the processes. The United States Justice Department claimed that Dr. Marcus has been doing outside work on government times, and they had the time cards to prove it. So they had time cards, but Marcus was the guy that got lead out of the water supply. And they've been after Dr. Marcus since he did that in the 70s. So he had kept copies of his time cards. And so what the government had as evidence was a forgery. So when the judge asked to have them bring in their forged time cards, Your Honor, they were accidentally shredded. That's when he banged the gavel and gave punitive damage to Dr. Marcus. So when the senior toxicologist, the Office of Drinking Water, discovers that we're putting a powerful carcinogen in the public water supply, is it any wonder? Do you know that cancer was almost unknown at the turn of the last century? In the 1900s, 3% of the people died of cancer. Half the people die of cancer now. You think maybe we're doing something wrong? So that's what Fluorigate's about. But it's not just about that. It's the other thing that Dr. Marcus found. Dr. Marcus found that even on the lead, is that there are genetic differences in the way children absorb lead. And that the standard for lead in the water supply. Like I said, he's the guy that got it lowered to what it is now. It's 15 parts per billion. That's the B word, billion. That's based upon a Caucasian. Blacks and Hispanics will absorb lead at 6 times higher rate. So at a minimum, 15 has to become 2 to protect subsets in our population. And that's not a safe level. That's just you can still sell the stuff. So they've hated Marcus forever. And he won his whistleblower lawsuit. They put him back, and he says pretty good job because he had a desk with no responsibilities. But they harassed him, so he sued him again and won again. So that's what Fluoridegate's about. It's not about fluoride. It's about the machinations of our government in order to keep a policy going that's saving industry billions of dollars because it helps them dispose of raw untreated hazardous waste from the phosphate fertilizer mining industry. The trouble is, after the hurricanes went through Florida, they broke out a holding pond that was made out of plaster of Paris. Would you build a holding pond out of plaster of Paris? Well, not if you wanted to keep the stuff in. But plaster of Paris is one of the byproducts of making phosphate fertilizers. So they had stuff that they would carry around in bulldozers and build a huge pond. And that killed off about 1/3 of the Everglades. But then they didn't have the silicofluoride to put in your public water supply. So the word went out to the world that the United States is short of silicofluoride. So China said, we can help you with that. And Mexico said, we can help you with that. Japan said, we can help you with that. And so now we're buying most of our stuff on the West Coast from overseas, Asia, and we're buying a lot of the stuff on the East Coast from Belgium and other countries in Europe that don't fluoridate because they got this stuff piling up. If you stop the use of water fluoridation, silicofluoride, and made them dispose of their hazardous waste, it's going to make phosphate fertilizer more expensive, and then organic vegetables and fruits will become a normal priced food. Oh, you think maybe that might interfere with the profits of Monsanto and Cargill and all of the other producers of agribiz food? Of course it will. So the money behind fluoridation isn't coming from the dentist, but we're the money launderers. Because those companies, if you go look at the donors to the ADA's nonprofits, they're the big contributors. They're giving the money to the ADA, and so the ADA sends their minions out to talk to us in our dental school about how good it is. So it's not a wonder that we're confused, because we're basically the result of manipulation of our education for profit. I want my money back. So that's what Fluoridegate's about. It's online. You can watch it. You can buy DVDs and throw them at people. And it's just part of the story. And that as you learn more about the Academy and the things that we've gone through in the years, basically bugs cause gum disease, bugs cause tooth decay. Kill them, kill them, kill them, and you'll have healthy patients. I think I'm ready for questions. Oh, and before anybody runs away, I see my wife is leaving, but she's not going to get continuing education credit. FBD, Fundamentals of Biological Dentistry, 92014 is your AGD code. And I repeat, I don't have any financial interest or product in my talk, and any of the companies offering grant monies or continuing education, medical education. I gave all the copies of Fluoridegate to the IAOMT. So I spent her money and gave it to the IAOMT. What's the matter? You can't remember 92014? FBD 92014. Wake your neighbor up. Make sure they get it down. Did you have fun? What do you want to hear more of? Oh, I have a question. Before you get a question, I get a question. How many people heard about this meeting from a postcard that was about the size of that Fluoridegate postcard? How many people received a postcard in their office and that's how they heard about it? Not a soul. 1, 2, 3, 4. Okay, so I was just interesting. We're trying to decide whether it's worth our money to send those out. So, because costs us money. You know, the post office, that like to get paid. Please. Shout. What do I have my hygienist irrigate with? Well, before I made this movie, I used to use chloramine tea. After I made this movie, I said, oh my God, I'm using a carcinogen to kill bacteria. So I switched to salts, ozones, and iodine. She has an ozonator, and for one of the most benign things you can use is ozone, or you can make up something similar to ozone with hydrogen peroxide. You need to look when you're done to see if the bugs are dead, and that's the humbling part, because I'm going to use this. That's fine. Are the bugs gone? Because the bottom line is nothing works all the time. Some bugs are tougher than others. There's a little short rod that we get into that's a booger to kill. That one, you almost got to use iodine or something like that on it. So.
And do you recommend a pre-rinse before cleaning?
No, actually, I recommend pre-irrigation before cleaning. Pre-med if there's any medical reason to. But basically, if you take an antibiotic often enough, you're going to end up killing off all the good bugs and have MRSA. So thank you very much. Unless there's a medical need for pre-med, I don't recommend it. Behind you. I say it again. Okay, Dave's coming with a microphone, but what process do I use to prepare the slide? And that I have a video on my YouTube channel. It's David Kennedy, DDS. It's a non-surgical biocompatible perio, and it actually shows you the process. We make a slide. You take a drop of saliva, and then I take a perio probe, and I reach down into all four corners. I call it the four samples. Your posterior, you go up on the mesial of the upper second molar, touch it with your perio probe, and pull it out. Try not to get any plaque on it. You just touch that gook at the very depth of the pocket, and take an Explorer and squeeze that off. And you go onto the lower, and you take that Explorer and squeeze that off, and you take it and squeeze that off. And so I take all four corners and pool the sample. I try not to get any plaque, because the plaque will make the cover slip rock and that sort of stuff, and you don't want to, and then it looks like you're scuba diving and so on. You just want an almost invisible drop from the very apex of that pocket. Then you put your slide cover slip on it, and I take the handle of my mirror, and I start in the center, and I go around a little circle. And so an almost invisible pinhead-sized speck becomes about the size of a pea, because you've squashed it out real thin, and that's so that your microscope can show you basically all the stuff spread out. It's not what the pocket looks like, but you can identify the organisms. And I have a score sheet that I use to, your white blood cells. If there's a lot of white blood cells, I don't care what's there, they're infected. So a lot of white blood cells is bad news. Spirochetes are bad news. If the spirochetes are organized and they formed a pump, or they're biting a white blood cell that's organized, they're too smart. You don't want that. The rods and there's 3 different kinds of rods. You just kill them all.
If you have a question, I'll just get the mic to you. So.
Oh, that'll help.
Do people who have shellfish allergies, they're not able to use iodine? Is that correct? Or
shellfish allergies is probably something different than iodine, because if you don't have iodine, you're going to die. So the solution is to test. That like we talked about the Clifford test. You can do an iodine test on skin. Okay. And take a drop of it and rub it on skin and see what they do.
And if is grapefruit seed extract something
That'll
that
kill. It turns the teeth a little green, though.
Okay.
It's grapefruit seed extract is fairly nicely antibacterial. So, and the tea tree oil. There's lots of things you can kill bugs with. Coconut oil.
Hello. With all the dry mouth from medications and stuff we're seeing now, what do you recommend? I mean, some of the prosthodontists in my area are making fluoride trays for people.
Well, that's what the VA recommends. But they haven't bothered to data mine to track the throat cancers. That there are 2 things. One, if you go, anybody that's not subscribing to Mercola.com, I recommend that you subscribe and get Mercola's newsletter, and he will talk about the gross over-medication of society and the use of drugs that you don't really need them for. Betty went to the eye doctor the other day to your eyes checked, and that the lady said, well, you haven't updated your medical questionnaire. And she said, well, what do you want to know? And she said, well, you didn't put down any drugs that you're taking. She said, I'm not taking any drugs. And she said, well, you need to put down the drugs that you're taking. And she says, I'm not taking any drugs. And she said, well, what are you taking for your blood pressure? And she says, my blood pressure is normal, a little low, actually. And what are you taking for your arthritis? And she says, I don't have any arthritis. She said, what is it about not taking any drugs you don't understand? This is a 24-year-old girl. She'd never seen anybody Betty's age that hadn't taken drugs. So we have a terrible problem in this country with drugs. You think methamphetamine cookers can make ephedra? No, they can't. It's coming from pharmaceutical industries that they're selling it to the drug dealers who are making the stuff that's on the street and yada, yada, yada. So the drug problem is here. It's real. And it's making money for the people. So one of the reasons you got all these dry mouths is they're taking all these drugs that are screwing up with the body works, and you might want to let them know that, gee, I'm really concerned about this lack of saliva because that's a necessary ingredient for healthy teeth. And that one of the things you can do is measure the strep mutans and kill it. My brother had radiation for his throat cancer, and that he started growing cavities like he never had any cavities, and started growing cavities like crazy. Iodine stopped it. So you can stop cavities by killing off the bugs that caused it. We couldn't get any saliva to grow for him, but there are some sialagogues. He found that carrying a bottle of water around with him all the time was plan B, non-fluoridated water. But there are some serious problems with the medications and oral radiation. So the solution is not more fluoride, but it basically you need to stimulate the saliva to flow again, and there are sialagogues. There are various medications. And that might be a situation where you use xylitol. You know, I'm not a great believer in xylitol, but you know there's worse things in life than killing off the bugs in your intestines, I suppose. So I don't have any good solutions to terrible problems. I'd rather have garden variety problems. Just give me something simple.
Have there been published studies on your techniques or similar techniques and the results?
The closest I can come are the Ramford studies that were done. And, as a matter of fact, there are people that claim to have studied the Kai's method, and that if you go pull all those studies out and look, they didn't use a microscope. Well, Kai's study did not involve baking soda, so there's studies where they use baking soda and said it's no better than this. Well, wait a minute. That's not the Kai's method. That's a focus on a material. So the Kai's method is look and see what the organism's name is and kill it. What you kill it with is immaterial. So there are no studies that I'm aware of that have done that. On the other hand, from a private practitioner, I can tell you that it works like 100% of the time, every time. The Ramford studies, Dean Ramford was Dean of Periodontics in the University of Michigan. I think there are 25 years of studies, and what he did was he was a surgically trained periodontist, and so what he did is he did surgery on the maxilla on one side and the mandible on the other, and he would alternate, doing left for right-handed people and right-handed for left-handed people. And he had quite a number of people in the study, and he tracked them for 25 years. And he had them back every 90 days for cleaning. And that what he found was that the side that he did surgery on lost bone more rapidly than the side that they had not. And this is especially true if they didn't come back every 90 days. If they came back every 90 days, the side that they did the surgery on was no better, actually a little worse than the side that they hadn't, and in terms of bone loss and tooth loss, than the side that they just scaled every 90 days. So if you don't do anything else in your practice, get all your periodontal patients back every 90 days and clean their teeth, because that's what Ramford's study shows, is surgery accelerates the disease. It also accelerated root caries and tooth loss. So that's the Ramford studies. They don't want to talk about it because it was basically done by one of their devotees, Dean of Periodontics, University of Michigan, and it shows that what we're doing is wrong. Well, when did they publish that? Oh, that'd be 1979. So, this is not new stuff. So where are the new studies that are set up to do this? They don't do them because they interfere with the current paradigm. And so if you did more studies like that, what you'd have to do is you have to change your mind. Have another one.
I have three things. Could you speak to the concentration of fluoride in composites and its release? That would be the first thing. Second one is, this group probably knows that Dr. Mercola that you talked about, this is Mercury-Free week, and that he matches any donations made this week for Mercury-Free dentistry. So I'd encourage everybody to hop on that site and donate. And then third, are there any community resources as far as what you're doing with fluoride that, or things like that that we could take to our local legislation if we want to try to help rid our local community of fluoride?
Let me start with the last one first. No. If you want to stop the local community from putting fluoride in the water, it's a long, arduous, difficult process that involves transparency, attention to detail, and compliance with all laws. And in order to do that, you need an elected official on your side. If you get a champion, we can win every time. And that's my friend Jeff Green. He didn't come this time because we're in court tomorrow in San Diego because they're trying to hide the ball. They don't want to tell where they're getting the money from because it's against the law for them to spend our money. So it's an unfunded mandate. And so anyway, they know that they're cheating. So basically, the money that's going into politics is coming from the ADA. One of the largest contributors to politics in the United States is the American Dental Association. And they're getting that money not from members, but from industry. And so there's basically a process of money laundering. And that the politician who wants to get reelected, that what happens is that if your politician becomes vocal in their opposition to water fluoridation, then the ADA targets them. And they fund their opponent and get them out of office. So we tell politicians not to become anti-fluoridation, become open government, transparency, compliance with all laws, because they've got to break several laws in order to do this. And so we show them where they have opportunities to throw a stick in the gears by compliance with all laws. Product has to be, like you send a series of inquiries, but you and I can't do it. It has to be from an expert or an elected or appointed official in a water board or a city council or some elected official, so they can send inquiries to the manufacturers regarding their compliance with all laws. And then what they'll get back, it's recommended by the ADA. Well, I'm sorry, I didn't ask you about that. I asked about your compliance with the law. And you obviously don't like our product. And so what you end up finding is that none of the manufacturers will tell you the truth, and that, eventually you can, it's a backdoor approach, but the frontal approach doesn't work because they're going to paper you with money. Same way as labeling GMOs. Is you can say, I want a label on GMOs. I'm going to fight for a label on GMOs. And Monsanto will come in and beat you to death. It's happening right now in Oregon. Please.
Hi. What's the percentage of povidone iodine that you irrigated with?
I don't use povidone. Usually do Lugol's. And that, as I said in the YouTube video, it doesn't make any difference. It's a splash. I just say a splash. It's turn the water just a little tinted. And that if you look at the YouTube video, see, it's not a precise measurement because it doesn't have to be. Because I've got four things in that irrigator that are going to kill bugs. I've got a concentrated salt solution. I've got the povidone iodine. I've got usually a mouthwash of some sort that's got zinc chloride or magnesium sulfate, Epsom salt. So it's got four things in there that'll kill bugs. So the splash of iodine is just the additional killer. Yeah, it's all together in a concentrated salt solution. Then I dilute it 50% with a hot water, so the temperature is exactly the same as the teeth, because it makes the patient a lot happier. So you don't squirt them with cold water. So anyway, that's the. But you could work out the percentage if you wanted to, but it's not particularly important, because what you're going to do is you're going to look under the microscope at the end and see if there are any bugs. And it's the same program as they have with fluoride. Is that if there's any bugs moving, do it some more, because they will all die. You can prove it to yourself by taking an eyedropper with one drop of your solution, put it on your slide on the edge of your cover slip, and watch it diffuse across the bacteria that are swimming there, and watch them all die as it goes across. So I've got a bug killer. So now you know you got something that kills bugs, and then the question becomes is, how good are you as an irrigator Do you have a cannula? Can you get down in the bottom of the pocket? Can you get this all the way around? And did you get the gook out of the way so you could get actually to where the infection's going on? So it's the application. It's a fairly low concentration, but it's the direct application on the bugs. Please.
Yes, Dr. Kennedy. I was wondering if you have any information on the brands of water we drink. Are there any better brands? In Brazil, we have mainly the water is fluoridated, and the water you buy too. And I'm worried about the water we drink. So, is there any very good filter you think that can help, or any brand that is better of water to drink?
Yeah, yes, and there are several websites like one of them is called Fluoride-free beer, and a fellow just bought the fluoride tester and started buying beer, and he said send him a bottle of beer, he'll test it. And so Fluoride-free beer has a list of all the fluoride levels in beer. You'll find there are several websites that list the amount of fluoride in various bottled waters. If you go on any bottled water, that in the United States they tell you how much fat there is in it, but if you go on here, it's got a phone number. By law, they have to measure the fluoride level. So if you want to know what level of fluoride is in the bottled water that you typically purchase, call that number, and they will fax you or email you the current breakdown of the water that they're producing there. So you know, in the United States anyway, you know that. In Brazil, I think they probably have a decent label on the water. I know they do in Mexico and in Europe. In Europe, they tell you about the mineral content. That's one of the reasons that we'll drink Panna water here is an Italian water, and it's zero fluoride is what it's noted as. So there are several websites where you can find long lists of fluoride, but don't think it's limited to water because it's also in your food. So there are websites that talk about the fluoride levels in food, real high levels in Welch's grape juice. It's a pesticide residue, but it's 6.8 parts per million every time we measure it. So that's from those planes with the two wings, and they're spraying sulfurofluoride on the grapes. So sulfurofluoride is a widely used pesticide. If you have termites in your house in California, they fill your house full of sulfurofluoride and kill the termites. So you also need to look at that. Mountain spring water, if you want to look at waters that have fluoride in it, they're basically hard waters that are near mountains with decomposed granite. And where we were in China, you see the paintings where they have the little pointy mountains like this, and there's some guy in the foreground that's all bent over and walking with a donkey cart. Well, the bent over guy's 30 years old. So the pointy mountains are granite, and they used to be square, and they've eroded down to little points, and so the soil is full of decomposed granite. Same reason you have high fluoride in Colorado, because the Rocky Mountains are granite, and they've eroded down. And where's my rock? Where's that rock? See that big green rock that's been going around? Find my rock. Tell me what the name of that rock is. Find my rock. Find my rock. Go ahead.
Can you make a connection with various cancers, say prostate, breast, with Clorox, chlorine, amalgam, mercury, so on and so forth?
Chlorine, yes. Amalgam, mercury. I know of one study that was looking at the breast cancer in amalgam. I think it's probably more likely linked to iodine. Sherry Tenpenny talked to our academy a few years ago, and she was talking about treating breast disease. And what she does is she loads the woman up with iodine, and she was showing some slides of fibrocystic breast disease. Have you ever seen that? It's awful. Where the breast turns into like a sponge and it's icky, but she cleared it up with iodine, and that's because every cell in the human body needs iodine, and if a woman nurses an infant, the breast milk will have the ideal level of iodine in it, even if the woman's terribly iodine deficient, and that means that the iodine is being stripped off of that woman's body to feed the baby. And as a result, you end up with iodine deficient tissues, and that's part and parcel of the problem of having one person have a little parasite in there and make another. But the way the system's set up is so that the mother ends up giving up everything so that the next generation survives. You can reverse that, and Sherry Tenpenny talked to our academy and showed how she reversed that. And one of the things she used was just gobs of iodine orally. And so that's why I feel very comfortable in recommending that people irrigate with iodine, because, we're talking about the fluoride topical. You can use iodine topically and spit it out, So it's that there are some people who react to iodine just like some people react to fluoride. They just typically ignore the ones that react to fluoride. But the way you do that is you ask somebody, do you react to iodine? And then if they do, you ask them if they would mind if you painted a swab of Lugol's or something on the back of their wrist or something, and you see what happens. If it disappears real quick, like in the next 24 hours, if you paint it and it's orange today and it's gone tomorrow, they're deficient. Their body is absorbing that iodine, so they need more of it. So anyway, and that's one of the reasons to react to it, is because they're so short of it. So breast cancer, prostate cancers, kind of a little low for my field.
So I've had a couple patients come in and they have been concerned about glycerin in toothpaste. MI paste has glycerin in it. They've read that it blocks remineralization and it coats the teeth. What are your thoughts on that?
I don't use MI paste, but I knew the guys that developed it, and that they used cheddar cheese was what they developed it from, because there were studies showing that people that ate cheddar cheese on a regular basis had lower levels of strep mutans and lower tooth decay. And so they took cheddar cheese and ground it up and made it into a bottle. And so now you can have a $20 bottle, or you can have a slice of cheese. So I sent them out to get the cheese, because I like the cheese better than the MI paste anyway, and there's no glycerin in it. So, if there's a problem, just go sideways. It's called duck. So, I don't know about glycerin, but the MI paste, the cheese will remineralize the tooth too. There's the great Nestor Shopka. Oh, fluoride composite. There's a nice handout from A, asking for the FDA approval. Doesn't exist. B, there's a nice handout from Griffin Cole, who put this together recently, our immediate past president here, and that he contacted a number of manufacturers, and that glass ionomer, things like that, always have some fluoride in it. It's like, the bench in front of you has fluoride in it. Fluoride's the 13th most abundant mineral on the planet, so everything's got fluoride in it. But what you're really concerned about is not, is it fluoride in it, is fluoride coming out of it. And so he specifically asked that question to several companies that have added fluoride to their product, and they say that's proprietary information they don't have to reveal. I disagree with that. I think that basically they're afraid that if they actually told you the numbers, that you either wouldn't buy it or you would buy it, depending on whether you like fluoride or not. But I would not recommend that you use any of the composites that leak fluoride, because you have no idea what concentration of fluoride is next to the soft tissue. Say, for instance, you did a facial on tooth number 2. What level of fluoride is the buccal mucosa exposed to that's rubbing on that facial composite? Well, remember, the rats got cancer of their lip and tongue from 79 parts per million. So we know that that's kind of a low threshold. Remember, a rat takes 20 to 100 times more fluoride to kill it. So here it's getting cancer at levels. Is it, what varnish? I think varnish, I've seen varnish with 50,000 parts per million fluoride in it. So if 79 is going to cause cancer of the lip, is 50,000 going to cause cancer of everything else in the mouth? If you look at the weight of the mouth, it's one of the highest cancer rates in the whole human body is the mouth. So the manufacturers need to be disclosing that their FDA approval. See, what you have, a composite that releases fluoride, has added fluoride, is what's called, the FDA calls that an adulterated product. So in order to adulterate a product with another product, they need to show the FDA approval. They need to submit a new drug application and show the FDA approval. Every time we've asked them for that, they have refused. So what do you know when they start taking the fifth? They don't have the answer. So if they don't, and you can go on the FDA website and look for NDAs for those, they don't exist. So we have in our dental community gobs of products that are not FDA approved, and that they're constantly going after physicians for prescribing products that are not FDA approved, and they lose their license. Is that possible for your dentist? Probably not, as long as you got the current dental board that's willing to wink and nod at the law. But on a lawsuit, you're going to lose. So if you have a patient that knows this, that says, she gave my child fluoride tablets, and he got dental fluorosis, and these are unapproved products, boom, the jury's going to not pay any attention to it's recommended or whatever. They're going to say, is that FDA approved? Not FDA approved? You gave them a non-FDA approved drug? So what's in the composites? I don't recommend any of them. Their ordinary composites don't contain any fluoride. They have barium glass as the filler for most of them, and you don't have to use the bonders that have the bis GMA either. You can use like diamond crown. There's different kinds of plastics, and the other thing you're going to ask about is the BPAs and so forth. Just use the ones that don't have BPA. So, like I said, go sideways. Don't worry about it. Just go sideways. Where's my rock?
I don't have your rock, but what about lasers and hygiene? Do you recommend disinfecting with lasers after root planing?
I recommend that you look under the microscope when you're done and see if it got them all.
Okay.
My only concern about lasers is the round corners, because they haven't made the light go around the corner yet, and so if there's an area in between the teeth that you can't get the laser, there'll be a little nest of stuff. Okay. And so if there's a nest of stuff, it's going to spread out tomorrow. And so you don't want to leave a nest of organisms there. So you need to completely disinfect the mouth. It's like I was joking earlier about only cleaning a quarter of the mouth at a time. No, you clean the whole thing.
Right.
So don't leave any. And so the way you can prove that to yourself that you're doing a good job of disinfecting is that when you get all done, take your biological sample in the most hard to reach areas, or a place where you think maybe I could have missed that. So you take your samples there and see if you did or did not.
Okay.
And then you'll answer my question.
Okay.
And then you let me know what you found.
Okay, well, one more question. What about, are there studies showing like root planing combined with laser therapy is more effective than
I don't know of any studies that see, they don't want to do that. That is too important for people to understand, is that companies fund studies to show that their product works, and that if we could make all studies that are started be published, it would totally change your mind. Because if you do 10 studies and one comes out positive and 9 don't come out positive, they publish the one positive one. Because this is an economy that works on selling stuff to other people. And so as long as we allow scientists to begin studies that don't ever end up published, we end up with a distorted picture of the results. And so I'm not aware of any studies where they've done a decent comparison.
Concerning the glass ionomer that always contains fluoride, I've been using that for a partial, how do you call that? Pulpal cap and direct. If you have a very large cavity, you're just next to the nerve, you don't want to have that root canal done, so you will place a temporary filling for 6 to 12 months. You take out most of the cavity, but you leave on the floor. What material would you use to temporarily fill that tooth?
To make your
make the dent
I know what you're saying.
harden.
This is called an indirect pulp cap or
Yeah,
direct pulp cap. Get ozone, because one of the things that really works good is what ozone does. It disinfects that. The bottom layer of decay is alive with that bacteria, even though it's not totally turned to mush. It's still got bacteria in it.
Yeah.
And so what you want to do is you want to kill that. And so you don't want to kill it with the fluoride, because fluoride also kills the nerve. But ozone invigorates the nerve, heals the nerve, gets the bacteria out of the blood supply in there. And so ozonate, they have a little tent that they put over. Phil Malika was in here earlier. He puts on a course for the Academy about ozonating. But anyway, you basically blast that decay with ozone, seal it up with your glass ionomer.
Well, you said you don't.
Well, you don't want to put it. Don't put it against the nerve. But the glass ionomer is basically silica cement. It's been in dentistry for 100 years. It doesn't leak that much fluoride. It's because it's sand. So there's some fluoride in the sand. It's not a high release fluoride. There are some companies add fluoride to it. Don't buy those. If you just use the stuff, or you can use Duralon or one of the polycarboxylate cements. All you need is stop. You can stop decay if you can stop ingress of saliva into the cavity area. So that's all you're really doing.
So in that case, you would not need to make a temporary filling and then a permanent one. You would already go with your permanent filling, right?
Only if I said it was a 2-year permanent. I would probably tell you that if you could do a direct composite over the top of rotted tooth, you put down rotted tooth, ozonated, blocked, 2 years, reopen and remove. And so in 2 years, you go back and reoperate and remove all the debris and put in a better restoration. But, you know, it's like a wounded soldier. You want to go in and you want to wrap them up, take good care of them, keep them alive for a couple of years, and then we can put them back together. So.
Okay. And what about if you have a patient for the tartar that has really huge amounts of tartar? You cannot do all in one day, would you?
I'm not talking about tartar. I'm talking about bacteria. So,
Yeah, okay.
you disinfect the whole mouth every time, and you don't even have to address the tartar until the mouth is well. As a matter of fact, Trevor Lyon recommended that you not address the tartar until the mouth is well. So in some ways, some of the difficulties that hygienists experience in cleaning mouths is because they're jumping in while it's still infected. That's why they get all the bleeding and the pus and all this stuff that they can't see through, so they can't get all the tartar out because the blood is coming from all corners. So if you disinfected the mouth, say for instance, if you just changed your perio control program and says, well, what I'm going to do is for the first 6 weeks, we're going to disinfect your mouth every 2 weeks, and you're going to do it at home, and we're going to do it in the office for you, and we're going to completely get rid of the organisms that are causing this terrible buildup of tartar and plaque and eating the bone around your teeth. And after those 6 weeks, then we will reevaluate, and then we'll probably schedule you for tartar removal, and then you can go in and remove the tartar. And what you'll find is that at the end of 6 weeks, that the gums have all shrunk up tight against the root, and they've snugged up, and there's a ring of tartar above them. And you can go and knock it off with your finger. It's beautiful. It's a nice thing. And I did have one guy had to grind it off with a diamond because it had been on there for 50 years. But Mr.
Dr. Kennedy, go ahead.
You got the microphone.
That's your description of the process of removing the tartar last is really counter to what I learned, and I'm not debating you, but I just always assumed that the tartar, the calculus, was gobs of bacteria, hardened, calcified.
It is. It's actually porous and full of bacteria. But the only way you can get the bacteria out of there is to saturate that tissue and the tartar with something that kills bugs, and that could be, we've talked about it all day today, you know, colloidal silver, iodine, whatever you want to kill it with. Doesn't make any difference. But what your bottom line is, you're disinfecting the mouth and then knocking the tartar off later, because you're basically, what you end up doing to the tartar is you end up disinfecting the tartar while you're disinfecting the gums. And then the tartar, we were told, and you and I went to school when we were taught that the focus of scaling was tartar. And so what we're trying to do is to take off the tartar is somehow is going to improve the oral health. What we know from W.D. Miller and C.C. Bass and Paul Keyes is that the tartar is there because of the bacteria. So the alternative is to get rid of the bacteria, and then what you have left is the deposit that was made by the bacteria. So the tartar is actually a product of the bacteria in there, and you can knock it off easily when you're all done. But thinking about biological dentistry, what you're doing is you're getting rid of the bugs that are causing the problem as opposed to knocking down their house, because they're just going to build another house. But even Ramford showed, and there's nothing wrong with knocking the tartar off. I'm just saying it's really hard to do when the gums are all bleeding and full of bad bugs. Get rid of the bugs and you'll find it's a lot easier. Is that clear? Are you with that? Yeah.
So your treatment, when you are saying disinfection, is just irrigation? That's what the whole appointment is?
Well, you know.
And education?
We start with irrigation, then floss and bass brush and de-plaque. You know, when at each appointment, when the hygienist is through, there's no visible plaque on the teeth. And you can take a probe and you can sample the bottom of the pockets and look in the microscope and there's nothing moving. So that's each visit from all the corners of the mouth. Each visit, we get rid of all visible plaque and all motile organisms are killed. And that's pretty easy to accomplish. It's not intuitive, and that's why I'm saying if you want to be humble, get a microscope, because you think you're doing that and you're not, and that's at least my experience. I wasn't, and so once you figure out that this is not a magic wand, you got to take this, you got to put it in there, and you got to run the little foot pedal, and you got to move it about a zillionth of an inch, and move it a zillionth of an inch, and make sure your solutions are concentrated enough that the bugs die. It's really pretty simple, but it's not a magic wand. So it's a learning process. It's no different than learning how to fix teeth. Yes. I got a microscope phone here.
For the irrigation, are you using irrigating syringes, or are you putting it in a cavitron, or what is the mechanism of sending the fluids underneath the gums?
All of the above. I've used a syringe. It's a little difficult. There's a device that you need that goes on the end of the syringe. A Luralock syringe, you need a device called a cannula. And it looks for all the world like a 22 gauge needle, but it's got holes on the side. So when you squeeze that syringe, it sprays out. You'll see it in my video. So a syringe is difficult to manipulate so you need, basically what you need is a syringe with a plastic tube that you can do the cannula in. So that's the $1.50 approach to being able to do biological irrigation subgingival. If you want to be the mechanic in the field, you go get a Volkswagen water window washer bottle, the real hard plastic bottles, and you put 2 quick connects on it, and you pressurize the top of it with compressed air. Whatever you put in the bottle will come out the hole in the bottom, and so that you can connect to your cavitron, and so it's called a bug buster. So then you can have whatever solution you want to run through your cavitron, and I tell you, if you run the salt through your cavitron, you'll kill your cavitron. So you want to run. I think the dental supply people recommend zinc chloride to run through your cavitron. So makes your cavitron a bug buster, so you can do that one. A water pick, standard water pick, they make an adapter for the end of it that turns that connector into a little soft plastic hose, and now you can have your cannula with a little handle on it, and that you get a little foot controller that runs your water pick. So that's what I was talking about a second ago. You run it like 2 pumps of the thing, so you're putting 1/10 of a cc of your solution in. What you do is you take that irrigator like you do a periodontal probing, 3 points around a tooth, only you're running it. So you're doing a periodontal probing while squirting the solution in 6 different places around each tooth. And if you've got a particularly nasty pocket, you give it a little extra blast, and then wash it all out, and then take a sample and go look and see if you killed them all. So all of the above, you're correct. Check D, all of the above, please.
Okay, so between appointments, do you have a home care protocol for the patients? Do you give them prescriptions? What?
The only prescriptions that I use are for the amoebas, and the amoebas the only time I see them 1 week apart, because I don't want them on the metronidazole for forever and ever, because it upsets their stomach and stuff like that. So if I'm after an amoeba, we'll pack around the tooth with metronidazole, send them home with 28 tablets to take a 250 milligram tablet 4 times a day, so taking 1,000 milligrams a day. And then we're going to see them in 7 days, and we're going to sample and make sure we got all the amoebas. We're going to pack more metronidazole around the teeth and irrigate them, or irrigate, then pack. And then we're going to see them 2 weeks later, tell them not to brush and floss the night before, and then we're going to take a sample and see what grew up. So did we get it all? So that's my amoeba protocol. And Oksana Swayak has an herbal protocol. It's a little more detailed than that. But so that's the only time I use a prescription, unless I've got an abscess or something like that. But even abscesses, you can make up a instead of buying the $150 plastic strips to leak tetracycline, you can take a tetracycline tube and capsule and open it up and crunch it up with a little aloe vera and mix it up with a piece of retraction cord and stuff it in a bifurcation involvement. It'll clean up an infection in about 48 hours. So, there's lots of, antibiotics are good, and if you can take a concentrated amount and put it right where the bad thing is, and you leave the string out and you have the patient take a hold of it and pull it out in 2 days, so that, you don't want to leave that in there because the string will become a problem. Then you check it in a week, and you'll be surprised. I can fix FERC involvement. How nice.
A lot of
my patients are insurance patients. So I'm just wondering, how do I explain the process to the patients? Because a lot of insurance companies won't even pay unless you provide the perio charting at first.
The way you provide the perio charting at first is very simple, is that almost all your insurance companies will let you do a new patient cleaning. And so what we tell them is that the new patient cleaning in this office is a thorough disinfection, because that's the word of clean. We're going to clean your mouth. And at the end of that cleaning, we're going to make a perio chart. So basically, you're cleaning, instead of endless hours of rubber cups running around, smearing pumice in between the teeth that annoy you, that we're irrigating, like we were just discussing a minute ago, and disinfecting the entire mouth so that we can do our perio chart. So that the new patient cleaning is exactly that. It's a cleaning. We're going to disinfect the mouth and make a perio chart. So there's nothing wrong with the insurance companies being involved. It's just that you got to know that they're entitled to having accurate records. And I did a perio chart on every person every year.
Is that the gross debridement code?
They've got numbers for it, but I just call, I didn't fill out the insurance forms. But honestly, there are numbers. There's applications. There's a number for applications of medicaments. There's numbers for slide preparation. There's numbers for preparation of slides. There are a whole list of numbers. I'd sit down and study them for each thing and had them all memorized and write them all down. But they'll pay you handsomely to disinfect the mouth. It's just you've got to figure out what numbers to write down for them. You just explain to the patient, that we polish the teeth at the last appointment. We don't polish at the beginning, because there's no point in polishing at the beginning. You want to get rid of the bugs, polish at the last. So it's called kill, 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 and count the bugs. Austin Rust, good to see you.
Dr. Kennedy, is the dental board requesting that we do a perio chart before we start perio treatment?
She's talking about an insurance company.
No, but my question is, in Canada, it's different maybe, but we get examinations to see if everything is fine, and they say that we have to do a perio chart before starting a perio treatment.
Well, I think you want a perio chart. I'm just saying that you don't want to do it by running your probe through infection. So that what I was saying, during the new patient cleaning becomes a disinfection appointment.
Okay.
So you can make a perio chart without spreading bacteria to the bloodstream. So they can't make you violate the patient's integrity. They can have their needs, and we can find a way to fulfill it. So. Oh, you can take an X-ray. If they got furca involvement and bone loss, you know what I did? I took photographs. In my office, I had back in the days of slides, I always had a box of slides going to and from. I took pictures of everything. And they have their people who are trying not to pay for stuff, and I would send them a picture of it. And said, here's what it looks like. You're going to tell me that's a good restoration? Because you could see amalgams were leaking. You could see, red puffy gums and recession, all that stuff. But they can't see it on an X-ray, so you can take a picture of it. And with the digital cameras today, every patient should have pictures taken more or less continuously.
Thank you, David.